Hip arthroscopy surgery, what is it, what to expect, advice, guidance, rehab advice, all the things and all the questions that you have if you've got a hip arthroscopy procedure booked. We're going to go through it all in this video. People who are being booked in to have a hip arthroscopy or keyhole surgery of the hip often are dealing with pain. Really, that pain is driven through a condition called FAI syndrome, which commonly is the cause of what we find is a labral tear that causes the hip pain. Now, the hip arthroscopy can be a really great procedure. However, if you're in hip pain and you're being booked to have surgery, it can be quite anxiety inducing. You can be stressed and worried. That is a normal thing. But in order to help with that, you need to understand, what should I expect from it? What are the outcomes going to be like? What's my physio? What should I expect from my exercises? And really, these questions are things that you need to know answers to so that you can prepare yourself physically and mentally for the surgery that you're going to be going through. Now, hip arthroscopy itself, it doesn't look like a big procedure, but it is a skilled procedure, and it is something that warrants and needs proper rehabilitation afterwards. I want to explain that in a little bit more detail so you know what to expect post-operatively and also what that physio should look like as well. Now, in order for someone who's having this surgery to have their labrum repaired, which is that bit of the tear that's often the thing that's causing the problem, and equally to have the FAI resolved, or whether it's just shaving off a bit of the bone or trimming down what that pincer would potentially look like. In order to do that, the surgeon has to get to the site of where that is, and in order to do that, there's a process in place where the hip joint is distracted, and essentially the surgical procedure is done in a way so that the surgeon can get to that area to do what they need to do. Now, I'm not here to bore you with the surgical procedure. What I want to kind of explain is the impact of that surgical procedure on the hip joint, because that's really important, because if you know that, then you know what to do rehab wise, and then you'll also know what normal feels like afterwards, and you won't be worried that, have I done too much? Is this what it should feel like? Has it not worked because it should feel like this? And etc, etc, etc. Now, the surgical procedure itself will mean that in some capacity, structures that are implicated within that, we need to try and address it in rehab. We need to kind of focus on the rehab from a physio perspective to build up the hip stability and strength back up. And we need to make sure in doing so, we don't do too much too soon. And I'm going to break it down into phases throughout this video so you can make sure that you really follow that step-by-step guide to understand what to expect. Now, let's start off from the days after surgery. Now, the days after surgery for some people can feel really good. You may be walking with sticks or some walking aids just to get your hip a bit more confident and get your confidence up, and also not irritating it too much. Is quite important to kind of consider that using the sticks and the crutches can be really, really useful. And those early stages, things will likely be a bit uncomfortable. It's normal. You've just had surgery. It's unlikely that you're going to wake up and everything's going to be completely pain-free. It might not be that painful, but certainly with certain movements and walking and weight bearing, it might be that you feel a bit of discomfort, and that is completely normal. What also is normal to get you up and moving and mobile as soon as possible, and that is completely safe to do. It might feel counterintuitive because you want to think like, I'll put my feet up, I'll relax, I'll rest, and sure, there's some rest that's needed, and that's part of recovery. But the focus is getting the hip moving and getting you functionally robust as soon as possible. And that target in that first phase is getting you functionally able. Doing steps, walking unaided, and just building your functional tolerance back up. Your exercises shouldn't have to be too in-depth and too extreme and too heavy. A lot of these phases in the early weeks is just getting your hip moving in certain ranges of movement, not letting it stiffen up, building your functional capacity so you can walk and go to the shops and drive and do things safely gradually. And that's that focus in those early weeks. Nothing too extreme, nothing too exciting, just doing the basics right. And within this time frame, you've got to make sure that you eat well, drink well, stay hydrated, And also just consider the fact that you are going to have some days where it feels a bit tight, some days where it's a bit sore, and that is completely normal. What we want to do is really get to the end of the first 6-7 weeks or so and make sure that the hip is calm. Make sure it's not too irritable, make sure it's not too flared up. And a lot of that comes down to just ensuring that those exercises and the rehab that you're doing at the beginning isn't too intense. We don't want to be doing any heavy hip flexor stretches, nothing too extreme to the end of range. But as we get into that second month, we're starting to do things with a little bit more challenge. And in this phase, we want to really make sure that we're building the stability of the joint. And this is working on something called the proprioception. And the focus should be on exercises and tasks that allow the hip to get its stability gradually back. Now, I need to get you guys to consider this. You're not going to see the lack of stability. This isn't an obvious thing. This is just something that would have occurred from surgery that means that we need to build it back up. But by no means do I mean that when you're walking or sitting, you're going to feel anything that's really that obvious. But these are the key things here. We don't want to run before we can walk. We have to respect the process of what's occurred, and we have to make sure that your outcomes are optimized. And by doing so, and to do so, we need to make sure that the rehab is pitched at the right stage at the right time. And that's why this second phase is really vital. That's why this second phase, over those few weeks from month 2 into month 3 and month 4, are focused around building the stability of the joint, which your physio will help you with, so that we can get to the third stage, which is really building up the strength of the joint. But by doing so, we're only getting to that point to know that we're not going to irritate it. Because what you don't want to do is have a joint that's probably a little bit more susceptible to being irritable or flaring up, and then doing exercises that are a little bit more too maybe robust or a little bit too challenging or taxing. So we have to build it up. We've got the first stage where it's a bit quiet and calm and building it up. We've got the second stage where it's working on the stability and the proprioception. And then we move into that third phase. And that third phase is when we really start to do the sexy stuff, the strength and conditioning exercises that we're used to seeing within physio anyway. And we're focusing here on building the global strength up of the hip. And that's where things start to get fun. And you really want to be in this phase and the phase before without the hip being too irritable. And you need to consider that this whole rehab journey from start to finish post-op, even if everything goes well, will take months and months and months. It's not a quick process. You don't want to rush it. You need to give it time. So if you're getting to month 4 and you're feeling great and you feel like you're progressing well, if you haven't got to that stage and then built the strength up sufficiently, again, you don't want to run before you can walk. You don't want to literally run before your rehab has incorporated exercises, incorporated rehab guidance that has built the hip's tolerance up to be able to allow you to run. Because sometimes the brain and the hip will feel absolutely great and it will tell you go for it. But remember, although you can't see what's going on, a lot has happened with that surgical procedure. You have to trust the process. You have to make sure that you're following the guidance of the rehab. Now the rehab, like I said, is following these phases: the calm phase, the stability phase, the strength phase. And it's only once you've got to the end of that phase, months after surgery, then you can start focusing on jumping around and hopping and landing and doing all those precursors of surgery, of running, to build up the hip's tolerance. And in doing so, what's happening? You're building up the hip's tolerance. You're also building your psychological resilience, your confidence to put the hip through those motions. Because look, if you haven't run for so much because the hip has hurt, you don't want to be the first time running on your own. You don't want to be discharged from physio, having done all your exercises, but never jumped around, never done the things that you'll probably do from running. And then you're on your own and you're a bit anxious and you're thinking, is this normal? Should I feel like this? And that's why your physio program has to incorporate it. And that's why that last phase, we refer to it as a dynamic phase, which is very much specific around moving the hip around different planes of movement with impact and force production. So all those kind of things that you would do when you're running, hopping, skipping and jumping. And that whole process can take a while. Now, if you're getting to that stage and things are feeling really good, then you're on to a winner. Then you're doing absolutely great. But look, I get that sometimes it doesn't follow the most perfect pattern of recovery. Some patients start really well and then they get worse. Some patients plateau and they struggle to progress. That can happen. Even when that happens, not all is lost. Don't get stressed, don't get worried, don't feel like you've made the worst decision and things haven't worked out. Take a step back, allow things to settle down. Approach it with someone's support, because it is challenging to do it on your own. Seek help from someone who deals with this stuff a lot, who understands hips. Take a step back, look at the program, try and identify all of the variables at play that influence pain. The physical things, the exercise, but also all the other contextual factors. Stress, anxiety, emotional well-being, sleep, diet, social histories, all these things influence pain. And take a step back and look at all those variables with the support of someone. See if there's something that we need to tweak or control that isn't just exercises that are driving that painful response. But even if it is that, consider the fact, well, have all the exercises followed the principles that I've said? Have I maybe done too much too soon? Do we need to actually, even if you're in the stage months wise where you should think you'd be in the strength one, well, do we need to take it back and revisit that calming phase in the early stages, albeit you're months down the line from surgery? Maybe we just need to start following these principles, because often the biggest pitfall, the biggest mistake that I see from patients who have had hip arthroscopy surgery, who haven't been doing so well, who are a bit anxious and concerned that their recovery hasn't gone as they planned, often haven't had physio at all, or the physio has started too far down the line, i.e. the hip post-op has felt okay, and then the exercises have been all about lunging and deadlifts and squats. And however fantastic those exercises are, remember, we still have 2 phases even before we get to that post-operatively, in order to make sure that the hip is tolerant. So although, don't get me wrong, some patients just don't respond well to hip arthroscopy. It's not 100% in all cases, but you can have an excellent outcome. And in order to do that, you have to optimize your planning. You have to optimize the surgical procedure, so doing due diligence with a surgeon who you know does a lot of them. And you have to optimize your outcomes. And to optimize your outcomes afterwards, it's about doing the physio properly. It's about making sure that you've got the right physio who's dealt with this, and you're following these principles of moving from the calm to the stability to the strength to the dynamic phases. But also having the consideration to think, if it's not working how I want it to, then we can just take a step back and revisit. Now, the rehab side of these things are absolutely vital. And over the course of this video, hopefully we've gone through some of the key principles and what we're going to be doing in videos that I'm going to tag in up here now, which you can click on to watch. And also at the end of this video, there'll be links to further rehab specific exercises that we're going to follow in this channel for you to utilize. So whether you are a patient who's wondering, actually, am I doing the right exercises, or what exercises could I do? Or even if you're a physio who is treating someone and you maybe haven't come across post-op rehab that much, this channel is going to be the place where you can start to gain some of that inspiration of what exercises to use and how to do them. So feel free to share. And I also want to hear from patients who have had this surgery in the comments. What are your experiences been like? What are the good, the bad? I want to share the knowledge within these comment sections so people can start to interact and also engage with others who have been through. And also, we have to consider that just because your situation hasn't necessarily followed the route and path that you envisaged, doesn't necessarily mean that it's going to continue like that. And there's a lot of scope to have great outcomes from this procedure. But like I said, I want to hear from you guys, so comment in the video.